1. Where does oxygen diffuses from the alveolar sacs to the capillaries or from the capillaries to the alveolar sacs? Oxygen diffuses from the alveolar sacs to the capillaries. Carbon dioxide diffuses from the capillaries to the alveolar sacs. The alveolar sacs are located at the ends of which respiratory tubes? Bronchioles. Which respiratory tubes do not have any cartilage supporting them? Bronchioles. What is the name of the major breathing muscle that separates the thoracic cavity from the abdominal cavity? Diaphragm. In order to inhale, the diaphragm muscle moves in which direction? Down. In order to inhale, the size of the thoracic cavity must and the pressure within the thoracic cavity must increase. Decrease. What is the name of the structure that prevents food from entering the trachea during swallowing? Epiglottis. The posterior portion of the nasal cavity, which consists of the pharyngeal tonsils, is called the what? Nasopharynx. When the diaphragm muscle moves up, it will increase the size of the thoracic cavity, thereby decrease the pressure within the thoracic cavity. What would the internal thoracic pressure have to be in order for inhalation to take place passively if the outside air pressure was 500 mm Hg? 498 mm Hg, just 2 mm difference for passive inhalation. The concept of the chloride shift is a situation where the chloride ions are entering into a cell and the bicarbonate ions are exiting the cell. If the pH is dropping, thus causing the blood to become too acidic, it is due to excess what ions? Hydrogen. If there are excessive bicarbonate ions in the red blood cell, there will be excess or not enough hydrogen ions in the red blood cell. Enough the bicarbonate ions will buffer too many hydrogen ions. If there are excessive buffers in the red blood cell, there will be excess or not enough hydrogen ions in the red blood cell. Not enough the bicarbonate ions will buffer too many hydrogen ions. If there are too many buffers in the red blood cell, the pH of the red blood cell will become too acidic or become too alkaline? Too alkaline. If there are too many buffers, they will buffer too many hydrogen ions and the pH will go up.